limit. Her gait is steady and coordinated. She's dressed perfectly for the weather, and she is oriented and alert, and her speech is clear. Hi, my name is Kate. I'm going to be your student nurse today. How are you?
Good, how are you?
Good. I'm going to be doing a head-to-toe assessment. You should take under 30 minutes, and we'll get you out of here, okay? Okay, first I'm going to assess your skin. Do you have any tattoos? Okay, I don't see any that are visible. Your skin is normal for ethnic background. I'm just going to feel. Okay, good. It's cool and dry. I'm going to assess your skin turgor. Okay, good. You have good skin turgor, which means it tells me you're not dehydrated. I'm going to check your capillary refill. Okay, good. Your color returns within 1 second, which is completely normal. Okay. And now I'm going to go on to your head. Your head is normocephalic with no obvious lumps or lesions. Your face is symmetric with appropriate facial expressions, and your hair is evenly distributed. Okay. And now I'm going to palpate your scalp. Okay. I don't feel any masses or lumps. Do you feel any tenderness?
No.
Okay, good. Your hair is healthy. Okay. Now I'm going to ask that you close your eyes. Okay. I'm going to touch an object to your face. When you feel it, say now. Now, 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 now. Okay, good. Cranial nerve 5 is intact. Can you smile for me? Frown. Squint your eyes. Puff out your cheeks. Okay. Okay, and your ear was an equal release, symmetric release, which is great. Cranial nerve 7 is intact. Okay, now we're going to go on to your eyes. I don't see any obvious lesions or abrasions with your eyes. I'm going to pull down the lower lid. Okay, the conjunctiva is clear. The sclera is white with no lesions. I'm going to pull the upper lid. Okay, your lacrimal duct has no bleeding, discharge, or any swelling. Did you feel any pain with that? Mm-hmm. Okay, good. I'm going to look inside of your eye. Okay, you can just stare straight ahead for me. Okay, the red reflex is present. The optic disc is creamy yellow. And arteries and veins are visible and they're paired, okay? Which is completely normal. And I would do the other eye, but for time purposes today, we're going to just do one of each thing, okay? Okay, we're going to do some tests. I'm going to ask that you cover one eye and read the smallest line on the Snellen chart that you can see.
8745.
Okay, good. That tells me that you have 20/30 vision, and what that means is that you can see at 30 feet what a person at 20/20 vision can see at 20 feet. Okay. Now I'm going to ask that you stare straight ahead and cover one eye. Okay. And I'm going to do the confrontation test. I'm going to cover my eye as well, and let me know whenever you see my pen.
I see it.
Okay. Other eye.
See it.
Okay. Good. Cranial nerve 2 is intact. And I'm going to ask that you stare. Now I'm going to ask that you stare straight ahead, and I'm going to do the cover test. If you can stare straight ahead, okay. And I'm going to put this in front of your eye, and we're going to see if you have any deviation. Okay. Okay. Good. No deviations. Cranial nerve 2 and 3 are intact. Now I'm going to do the corneal light reflex. If you can stare straight ahead for me again. Okay, good. You have symmetric reflection in both eyes, which means cranial nerve 3, 4, and 6 are intact. Then I'm going to do the diagnostic positions test. If you could follow my pen. Okay, good. You had parallel movement. No nystagmus or lid lag was present. Cranial nerve 3, 4, and 6 are intact. Then I'm going to do the light accommodation. You could stare straight ahead for me again. Okay, good. Pupils are equal, round, and reactive to light and accommodation, so cranial nerve 2 and 3 are intact. Okay. Now we're going to move on. We're going to go to your nose. Your nose is midline. There's no obvious lumps or lesions. We're going to look inside of your nose. Let me just get my equipment ready. Are you doing okay?
Yeah.
Okay, good. Let me know if you have any discomfort or if you have any questions about anything.
Okay.
Okay. Okay. Gonna look in your nose. Okay. Your mucosa is pink and moist. There's no obvious lesions, bleeding, or any discharge. Your turbinates are consistent with your mucosa, and your septum is midline with no perforations, which is completely perfect. Okay. And I would do the other nostril, but for today, like I said, I'm just going to dispose of this. Okay. We're gonna do. I'm gonna do one more test, another test on you. I'm gonna include one nostril, and I'm gonna have your eyes closed. And when I say inhale, tell me what you smell.
Alcohol.
Alcohol. Okay, good. Crayon nerve 1 is intact. Okay. Now I'm gonna palpate your sinuses. You're gonna feel some pressure, but you shouldn't feel any pain. Okay, your frontal, maxillary. Did you feel any pain there? Okay, great. And now we're going to move on to your mouth. I'm going to palpate for your TMJ. Okay, if you could perforate your jaw, yep, and side to side. Okay, did you feel any pain? Okay, there's no crepitation. I'm going to ask that you tighten your jaw, clench it. Okay, good. Your muscles are firm and symmetric, which is great. Okay, now we're going to inspect the inside of your mouth. Okay, your teeth are white, healthy, and clean. Your uvula is midline. Your tonsils are present 2+. Your hard and soft palate are pink and moist. Your tongue and frenulum are pink and moist with Wharton's duct is not visible. Your mucosa is pink and moist. Stinson's duct is not visible. And your pillars and posterior pharynx are pink and moist, which is completely normal. I'm going to test your gag reflex. Okay, good. Can you swallow for me? Okay. Can you stick out your tongue and say ah? Okay, good. Your soft palate and your uvula move symmetric with that, which tells me that cranial nerves 9 and 10 are intact. Stick your tongue out for me. Okay, your tongue is midline. Can you say light, tight, dynamite? Light, tight, dynamite. Good. Cranial nerve 12 is intact. Can you push your jaw forward? Okay, open it wide. Okay, and I'm gonna pull it down on your jaw. Try to resist my pull. Okay, good. Cranial nerve 5 is intact. Then I'm going to do another test. I'm gonna ask that you close your eyes. And I'm going to put something on your tongue and tell me what you taste.
Salt.
Okay, good. Cranial nerve 7 is intact. Now I'm going to move on to your ears. Your ears are symmetric. No obvious lumps or lesions. I'm just going to palpate them. Okay, don't feel any lesions. Do you feel any pain there? About your tragus? Mastoid process? Okay, good. Now we're going to inspect the internal ear. Okay. Okay, your ear canal has no obvious lesions, bleeding, discharge, or redness. Your tympanic membrane is pearly gray, shiny, and translucent. Your umbum renubrium and short process are visible. And your cone of light in your left ear is present at 7 o'clock. And then I would do the same thing on the other ear, but the only difference would be that the cone of light would be at the 5 o'clock position, so it's 7 o'clock. Okay. Throw that away. Okay. And that's good. I'm gonna do a couple of tests on you. I'm gonna cover one ear. Tell me what you hear.
ABC.
1, 2, 3. Okay, good. That was a whisper test. Cranial nerve 8 is intact. I'm gonna do a couple more. I'm gonna do the Weber test. Tell me if you hear an equal amount of sound in each ear.
I did.
Okay, good. Cranial nerve 8 is intact. Now the Rennie test, I'm going to do the same thing on the sides of your ears, but tell me when you no longer hear any noise, okay?
No. No.
Okay, good. Your air conduction was longer than your bone conduction, which is great and shows that cranial nerve 8 is intact. Okay. Okay. So now I'm going to palpate your lymph nodes. I'm going to have preauricle, postauricle, occipital, superficial cervical, deep cervical chain, posterior cervical, supraclavicular, tonsiliar, submandibular, and your submental. Okay, and I'm going to now, did you feel any tenderness or pain? Okay, I didn't feel any swelling of the lymph nodes, that's great. I'm going to palpate your carotid arteries. Okay, they're smooth and 2+. Your trachea is midline. I'm going to osculate your carotid arteries. Okay, no bruises are present. I'm going to palpate for your thyroid. If you could put your head down and to the right and down, and then take a swallow for me. Okay, did you feel any pain with that?
No.
Okay, your thyroid was not palpable. Okay. Now I'm going to do some range of motion tests on your head. I'm going to have you put your head forward and backwards. Okay, that's full range of motion, flexion, extension. Can you touch your ear to your shoulder? Okay, full range of motion, lateral bend. How about side to side? Okay, full range of motion, rotation. I'm going to feel your sternocleidomastoid muscle and your trapezius muscle. Okay, they are equal and symmetric. I'm going to ask that you shrug your shoulders. I'm going to resist you, okay? Okay, good. Cranial nerve 11 is intact. Now I'm going to listen to your heart sounds. Warm it up for you. You have your aortic at your second right interspace. You're going to have your pulmonic at your second left interspace. Your tricuspid at your left sternal border. And you're going to have your mitral at your fifth interspace, midclavicular. Your fifth left interspace, okay? Good. I didn't hear any murmurs or any irregular beats. Your S1 was your loudest at your base, and the S2 was your loudest at the apex, which is absolutely normal, okay? Now I'm going to do your respiratory test. I'm going to ask you to take a deep breath in. Okay, your symmetric expansion was symmetric and equal, which is great. And I'm now going to do the tactile firmitis. If you could say 99.
99.
Every time you feel 99.
99. 99. 99.
Okay, good. It was symmetric. It was symmetric vibrations. I'm going to do I'm going to do resonance percussion. Okay. Okay. It was symmetric. I didn't hear any dullness or hyperresonance, which is completely normal. I'm now going to do the costovertebral angle of tenderness. You're going to feel some pressure, but you shouldn't feel any pain. Let me know if you do. Okay, great. Now I'm going to listen to your posterior lung sounds. Okay. Okay, I didn't hear any crackles or wheezing. It seemed clear. Now I'm going to oscillate your anterior lung sounds. I have your bronchial. Okay, your bronchiovascular. Okay, your vascular. Okay, good. Your lung sounds are clear. Okay. Now I'm going to ask that you lie down. You can pull your shirt up. I'm going to inspect your abdomen. Okay. Your abdomen is flat, has bilateral symmetry. Your umbilicus is midline and inverted, and all your nevi are under 1 centimeter, which is completely normal. Okay. Now I'm going to oscillate for bowel sounds, starting in your right lower quadrant. Okay, bowel sounds are present, high pitch and gurgling, which is normal. I'm now going to assess for bruits in your aortic, your right and left renal, your right and left iliac, and your right and left femoral. Okay, great. No bruits are present. I'm now going to do a light palpation just to get a feel for your stomach. Okay, did you feel any tenderness?
Mm-hmm.
Okay, good. I didn't feel any distension or rigidity or any masses. I'm now going to do a deeper palpation to get a feel for your organs, okay? Okay, any pain with that? Okay, your liver, kidney, and spleen were not palpable, and your aorta was about 3 centimeters wide and had a anterior pulse. Okay, now I'm going to do liver dullness. I'm just going to percuss. Okay, here's some dullness, which means I'm over your liver. I'm just going to go over a little bit so I hear some tympany. Okay, here's some tympany. That means I'm in the stomach region. Okay, okay, great. That's all for that. You can put your shirt down. Okay, and sit up. I'm now going to do, I'm not going to go onto your arms. I'm going to assess they are symmetric. They have no obvious lumps or lesions. I'm going to just feel them. Okay. They are bilateral warmth. No epitrocular lymph node is palpable, and there's no obvious edema, heat, or swelling. I'm not going to palpate for your pulses, your brachial, okay, present 2+, your radial, starts meter watch, okay, good, present in 2+, and like I said, I would do on the other arm as well, but for today, I'm just going to do one, okay, and then I'm going to do the deep tendon reflexes, okay, okay, I'm going to hold your arm right here, I'm going to do your biceps, okay, good. I'm going to do your tricep. Okay, great. Then we're going to do some full range of motion tests. First, could you resist my pull? Resist my push? Okay, great. Bilateral strength, which is great. Okay, I'm going to ask that you do flexion, hyperextension, exverted rotation, inverted rotation, abduction, adduction, and circumduction. Okay, great. Full range of motion in your shoulders. So like once again, we would do on the other, but for today, we're just going to do that. Okay, I'm not going to assess your legs. They are symmetric. The muscles look symmetric as well. There's obvious lumps or lesions. I'm going to palpate the legs. Okay, I don't feel any lumps or lesions. Although she has jeans on, I don't feel any pain or swelling, any heat or swelling, or edema, which is normal in omnivore under 1 centimeter. And I'm going to now do the deep tendon reflexes. Okay. I'm going to do the patellar and okay, great. And I'm going to do the tibial. Okay, great. Your deep tendon reflexes. Now I'm going to ask that you stand up. Okay, I'm going to ask that you bend your knee and flex your knee. Okay, go for full range of motion in your knees. Now I'm going to have you, actually, could you sit back down for me 1 second? I'm going to do inlet and lie down. I need to do your range of motion in your hips. Okay, I'm going to do flexion and extension. Okay, and straight leg up. Okay, good. Now I'm going to do abduction and adduction. Okay, external rotation and internal rotation. Okay, good. Full range of motion in your hips. And once again, we would do it on the other side, but for today, we're just going to do it on one. Okay, and then now I'm going to ask that you stand up, and I'm going to have you bend over for flexion. Okay, straighten for extension. Okay, good. Your spine is straight. Full range of motion. I'm going to now we're going to do some neurological tests. I'm going to do the Romberg's test. If you could just stand straight with your arms by your side, your eyes closed. I'm going to assess for any swaying for about 20 seconds. Okay. There's no swaying was noted, so that's a negative Romberg's test. Okay, I'm going to ask you to stand on one foot, hop to the other. Okay, good. Your balance is you have good balance. Now I'm going to do the tandem walking. If you could touch your heel to your toe for about 3 to 4 steps and back. Okay, good. You have good balance. Now I'm going to ask that you touch your fingertip. Okay, yep. That is, you have good coordination. Now I'm going to ask you to close your eyes. I'm going to draw a number in your hand. Tell me what number you feel. This is the graphesthesia test. 7. Okay, good. I'm going to put an object in your hand with your eyes closed once again, and you can feel the object and tell me what you feel. A penny. Okay, great. And that was the stereogenosis test, and that was great. Okay. I'm going to go and check my notes really quick and see if there's anything else the doctor wanted me to assess. And I'll be right back. You can have a seat and get comfortable. Let me know if you need anything. Okay. there actually were a couple more things. I'm going to ask that you lie down once again. Okay, I'm just going to feel for your pulses in your feet. I'm going to do your dorsalis pedis. Okay, it's present in 2+. I'm now going to palpate your posterior tibial. Okay, and that's present 2+. And I'm going to do the range of motion for your ankles. If you could do plantar flexion down, okay, dorsiflexion up, okay, invert this way, evert this way. Okay, good. For range of motion, your ankles. And once again, I would do the other side, but for today, we're just going to do one. Okay, and then I'm going to ask that you sit up. And I'm going to, and when I did the deep tendon reflexes, that's actually the Achilles, not the tibial. I'm sorry about that. I'm just looking at my notes one more time. Okay, and I'll be right back. Okay, and then I'm going to ask that you flex and extend your arm. Okay, and can you pronate and supinate? Okay, great. Full range of motion in your elbows. Okay, and I believe that's all for today. Do you have any questions about anything? Okay, great. And that's all for your assessment. Everything looks completely normal and looks great. Okay.